Hey everybody, it's Dr. Ashley, pediatric emergency mom. Happy Wednesday. Pretty sure it's Wednesday. Hope y'all are having a great week and a happy holiday. And one day I'm gonna do some lives that are just like straight up happy news, all happy news. Today it's like a little less happy, but probably what you would expect from me this time of year. And so 'tis the season, right, for kids to all be spreading their germs. God love them, they're so cute. But what we're seeing is a rapid rise in rates of influenza. And it's kind of interesting when you look at message boards across the country. Like some people are seeing influenza B. We in Louisiana are seeing influenza A, which is primarily more respiratory symptoms. And so runny nose, cough, congestion, body aches, fever. I'll tell y'all, flu, or I'll say like 99.999% of kids with the flu have fever. So if your child, or if I'm seeing somebody in the ER and mom says, just nasal congestion, cough, just kind of not feeling well, but no fever at all, then the likelihood of them having flu is pretty low. But flu is super, super contagious. We know this. And the incubation period is fairly short. So just like 24, 48 hours-ish. So much shorter than, say, COVID. Remember, especially in the beginning, that incubation period was really long. And so kids will maybe go to school not feeling so great, maybe don't have fever, but they're actually brewing the flu. And then that becomes a big spreader event in classrooms, which is, it kind of is what it is, but it's unfortunate. So this is why it's super important to not send your kids to school if they have fever, or if they're feeling really crummy, even if they don't have fever. But all of that to say, I posted an article earlier that was from a local news source here in Baton Rouge. And the title of the article was pretty misleading. I think I read the title and thought, oh my, what? Am I missing something? And so the title said the cases of influenza, are rising in Louisiana. Okay, check, got that. But then the second part of the title said experts warn against unusual pneumonia in children. And I thought, I feel like I am an expert on sick children. And I don't know what they're talking about. Did I miss something? And then I read into the article, and so they're talking about two different things. They're talking about influenza, but they're also talking about, they don't say it by name, but they're talking about the increased rate of Mycoplasma in the community. And so Mycoplasma is a very small bacteria that for the most part causes upper respiratory symptoms, some cough. Usually you can get better without any treatment. It's self-limited like most other viruses, although Mycoplasma is a bacteria. But your body can fight it off pretty well. And it's only when it worsens, so when it progresses to more significant, especially lower respiratory disease, that it does require treatment. And we will also treat immunocompromised patients, empirically, for Mycoplasma pneumonia. So a sickle cell patient, for example, if they have cough, congestion, fever, increased work of breathing, then we're going to treat them with antibiotics and azithromycin for that Mycoplasma, even without testing them, right? Just to be safe, because they have such compromised immune systems. So all of that to say, why are we seeing this uptick in Mycoplasma pneumonia? And Mycoplasma pneumonia is also known as walking pneumonia. And the reason for that is because these patients, for the most part, especially if they have that self-limited, gets better on its own version, are walking around. They're not laying in bed, feeling really, really terrible. They're kind of walking around. And so that's where the term walking pneumonia came from. So why are we seeing more walking pneumonia now? I truly think the number one reason is because we're testing more for it. So, when I started residency training and even in my fellowship training, we were not routinely doing viral testing. Even for the flu, if we started seeing an uptick in flu cases and I had a patient come in, and they just screamed flu, right? Like they have fever, they have body aches, they're not really wanting to eat or drink. The whole family has it, then I would even say like, hey guys, like I can test you for the flu, but you have the flu. Over the years, viral testing has become more common, and it's become more rapid. So we have point of care testing now that's pretty quick. Whereas in the past, it might be 45 minutes or an hour before you have those tests back. We also now have the ability to do viral panels, which is, I describe it to parents as like a one swab that tests for like 15 different viruses and Mycoplasma. And that's kind of, depending on where you work, that might be the fastest way to test for Mycoplasma. The reason we don't do this routinely for every single kid that comes in with fever, respiratory symptoms is for a few reasons. Number one, it takes a really long time to come back. Number two, it costs a lot of money. But most importantly, number three is that it really doesn't matter what virus you have, whether you have rhinovirus or RSV or human metapneumovirus or OG, original COVID, because we treat them all the same. It's symptomatic treatment, it's hydration, it's monitoring their respiratory status, their input-output status, it's all of those things. And the only time the treatment changes is if you have the flu and you're falling into that 48-hour window from presentation, from onset of symptoms to presentation, that maybe you would be able to fall into that time frame of being treated with antiviral medication. Or if you test for Mycoplasma, if you test positive for Mycoplasma, and sick enough to be tested in the first place, and then maybe you need azithromycin or other such treatment for Mycoplasma. And so I think we are, because those tests are more readily available and more people are using them, we are seeing an increased rate of Mycoplasma because we're testing more for it. We also, at any given time in the year and at a point in any illness, if there's increased community spread, there's going to be increased illness. And so we did see a few months ago more patients with Mycoplasma having more significant lower airway disease. So what does that mean? These are the patients that are really having labored breathing. Maybe they're wheezing and they haven't wheezed before. Maybe it's exacerbated their asthma. But when I'm listening with my stethoscope, they have different lung sounds. So it's not just nasal congestion, mild cough, that kind of thing. It's more significant lower airway issues. And so just flipping back to the flu really quickly, I've had this conversation so many times in the last few weeks. But as far as treatment for the flu, so there are two medications that you can use to treat for the flu. One is Tamiflu. That's the one that's been around for a really long time. The other is Xofluza. So both of them, if you're going to treat, you should start within 48 hours of symptoms starting. Xofluza is the newer medication. That medication is approved for ages 5 and over. Tamiflu is approved from infant to older patients, to adults. The Xofluza for kids, so it's a one-time dose. It's a much more expensive medication, right? Because it's pretty new. The side effect profile for kids is much better than Tamiflu. I always talk to patients about Tamiflu because if I don't, and they go home and mom tells aunt or grandmother, like, oh, he has the flu, and then aunt or grandmother says, well, did they give him Tamiflu? And mom says, no, they didn't say anything about it. Like, that's something I want to avoid completely. So I want parents to be informed and have the information and be able to make an informed decision. So Tamiflu years ago worked really well, right? And this is, I'm generalizing like really generalizing, but years ago it worked really well. And so instead of like 7 to 8 days of fever with the flu, Tamiflu dropped you to like 3 or 4 days of fever, and really helped with the spread and helped patients feel better, and really worked well. Now, over time, the flu has become wise and has done its thing where it's like, I'm going to try to avoid anything that works to kill me. And so it's gotten wise to Tamiflu, and Tamiflu doesn't work quite as well as it used to. Actually, it doesn't work anywhere near what it used to work. So now you might get 24 to 48 hours without fever. The biggest issue that I have with Tamiflu, anecdotally, personally, is the side effect profile. This side effect profile is significant. In kids, severe headache, vomiting, hallucinations, terrible skin rash. I mean, these are, and it's not just like, these are the side effects that are written on the piece of paper that comes with the medication. These are the kids I've seen in the ER with really impressive skin rashes, kids that are just out of their minds hallucinating. In the younger kids, if they have severe headache or hallucinating, then that presents itself as just like severe irritability. They're just inconsolable. And so it's not a medication without risk. When my kids have had the flu, before Xofluza was available, when they had the flu, I opted to not give them Tamiflu. Now, that being said, if you're high risk, if you are a patient with an immunocompromised state or chronic lung disease, etc., then it is recommended for you to get that treatment with Tamiflu or Xofluza. I can't speak to the adult population and those side effects, but I'm speaking to the pediatric population. And so that's what we're seeing, right? And it's not unexpected. Like, this is the time of year when we see the flu. We are also seeing a ton of RSV. Little babies who are drowning in snot. Sorry, that's gross, but that's what's happening. It's just they're overproducing mucus and they can't breathe. And so their airways, their little airways in their lungs are just clogged up with mucus. They don't have the chest force to be able to cough that mucus out and clear that mucus. And so they end up having pretty significant respiratory distress. And that's a hard one because there's not a medicine that makes that better quickly. There just isn't. That one really is time, suction, making sure they're drinking, making sure they're having wet diapers. And, you'll get to the point, or not you, hopefully not you, but parents of especially infants, young children with RSV, get to the point where there's nothing else you can do at home. And the right thing to do is bring them into the ER. We used to admit these patients for observation, for suction, for IV fluids if we need, and just kind of wait it out. And a lot of the time we weren't doing much more than parents could be doing at home. And then some really smart people that do amazing research, so then I don't have to do research and I can just read their amazing papers, did a whole bunch of research that said, you know what, we can put these babies on high flow oxygen. And so what it is a nasal cannula that goes up the nose. And so that oxygen is pumped through at a higher pressure. So it helps to kind of inflate the lungs at baseline, which helps to move the mucus out. And some of these babies don't even need oxygen. They can just use humidified air. But some do need some oxygen. And it is remarkable how quickly they settle down once you put them on this high flow. The research has shown that the quicker you put them on the high flow, the less time they spend in the hospital. And so that's something we've started to do for those babies. Another one that we're seeing is rhinovirus, which is the common cold. And if y'all followed me for any length of time, you have heard me say that there's nothing common about the common cold because it can make you sick as stink. Even teenagers, I've had teenagers recently in the last few months who've never wheezed before, who have come in significant respiratory distress and wheezing because of rhinovirus. So, but again, it's treating those symptoms. So, it is like, as far as the article that came out and the uptick of flu in Louisiana, it's the season. This isn't unexpected. I didn't like that other part about the unusual pneumonia in children. I wanted to address it because I just smacked of like COVID articles and parents being terrified because of information that came out that just wasn't accurate. It's kind of felt nostalgic as far as that goes. But just please, if you haven't gotten your flu shot, sorry, the dogs are, as our friend says, singing the song of their people. I don't know if you can hear them. If you haven't gotten your flu shot, it's not too late. Please get your flu shot. Again, the flu shot doesn't stop you from getting the flu, but if you do get the flu, your symptoms will be far less severe than those who haven't gotten the flu shot. Be very aware during holiday gatherings. Encourage family members to be very honest about their symptoms. Everybody wants to get together. Nobody wants to miss out on a holiday gathering. But if you know you're coughing and you don't feel great, please don't go to someone's house and spread whatever you may have, right? Please also be aware of newborns and parents of newborns, of infants. Everybody wants to meet the baby around the holidays. It's so hard. They're so cute. Everybody wants to love on them, but these little ones have been getting so sick, and we've seen a big rise in our hospitalization rate for babies with bronchiolitis. So that's like that overproduction of mucus in the lungs. So anyway, I hope you guys have a good evening. I don't know, when I do these lives, like sometimes I can see questions and sometimes I can't. And so I'm sorry if there are questions and I've like missed them. But if you do have questions or comments, please just say drop them in the comments to the video, and I'm happy to cover that. I hope y'all have a good evening and happy holidays.